Global Research Nurses, building a community of practice to support nurses and midwives leading and working in research. The Global Research Nurses Hub is one of the member hubs of the Global Health Network. Let's take a look at the Global Health Network.
So the Global Health Network has been running for about 10 years now, and working with nurses has been part of our efforts from the get-go. The Global Health Network was set up to try and support research where there's very little evidence happening, because in the most impoverished regions of the world, there's far too little research happening to change the outcomes in those populations. So we set up the Global Health Network to try and share expertise between diseases, regions, roles, organisations, but also between nurses and doctors and lab staff to try and encourage research where there isn't research happening. Research is very unfair across the globe. In fact, 90% of the world's research that happens benefits just 10% of the population. And that 90% is obviously in the wealthy north, because most research happens to develop drugs and vaccines for the diseases of the wealthy, and diseases of poverty miss out. And furthermore, research is changing really fast. We're moving away from the old phase 1, 2 and 3 clinical trials and beginning to think of research as much more of an ecosystem where you need all these different steps to truly understand what's going on with the disease. So surely if we need to shift from this gap of research in low and middle income countries, we need to think about who's at the front line, and that of course is nurses. So we've been working with the Burdett Trust for Nurses for many years to set up the Global Health Research Nurse Hub. And this network aims to bring together all types of nurses working in low middle income countries and try and encourage them to develop research careers. And this is so important because the type of research we needed is to cut across all these areas. We need to understand diseases better, we need to work out where interventions could be put into place, and then we need to measure them in these communities. Nurses are perfectly placed and should be doing this. And this also gives them a voice and gives them an opportunity to grow their careers and develop even further. So we're really fundamentally backing having nurses working across everything we do in the Global Health Network.
Global Research Nurses is a network developed by nurses for nurses. The prime focus is to help nurses engage, learn and seek opportunities to work in clinical research and ultimately develop and lead their own studies. Global Research Nurses endeavors to give research nurses and midwives a voice. We strongly believe that nurses who lead clinical research will become change agents and improve clinical outcomes. By undertaking pragmatic research into the clinical issues nurses face in the practice, nurses will be instrumental in transforming the health of their communities. Since the creation of the Global Research Nurses Hub, we have been developing new training courses, run local workshops, deliver webinars and engage nurses in all our regional capacity development activities. The impact focuses on nurses and the work and their careers. Through our Burdett Trust Award, we have 4 regional nursing coordinators based in Africa, Latin America and Asia who are tasked with coordinating our work with research nurses and midwives. These regional coordinators are able to give local nurses and midwives a voice and a strong presence within our activities, both face-to-face, prior to COVID, and online. Let's meet 2 of the Global Research Nurses regional leads in Africa and Asia.
I am Mr. Raleigh, Global Research Nurse African Regional Lead. I am also the Chief Executive Officer of Blue Touch Home Care Limited, the first registered home care agency in Nigeria, and I'm the founder and president of African Nurses and Midwives Network. In my role as a research nurse, I am majorly a clinical research nurse educator, equipping and training nurses across Africa in clinical practice who are intending to become clinical research nurses and nurses who are also in community practice. We equip these people with skills required to carry out their roles as research nurses. And this program equips nurses with the necessary information and skills they need or require to become research nurses. I started my role as Global Research Nurse African Regional Lead in 2014. During this time, I have organized about 5 training and skill sharing workshops, 2 international nurses day programs with nursing departments in hospitals and training institutions in 2 geopolitical zones in Nigeria, Lagos and Enugu, Enugu in southeast and Lagos in southwest. And we have trained about 2,000 nurses during this process. And all the programs we have done during these processes so far were all free to attend for nurses, and they were also giving workshop materials. Looking at these slides, you can see some programs we have done. One captioned with COVID-19 webinar in May 2020 and nurses visual workshop in July 2020. You all know that during this pandemic, the emergence had actually paralyzed programs all across the world. And knowing that this is the year of the nurse, we needed to do something to adapt and find new ways to do our programs, being innovative. So we tried to form collaborations and partnerships with the pool of nurses and experienced nurses across the networks we have developed before. And in May 2020, we tried to have a program called the COVID-19 and its effects on nurses. So we aim to establish a community of practice of nurses across Africa to support the implementation of research within COVID, bringing together the regional experts in the field with inputs from Nigeria, South Africa, and Zambia. Also in July 2020, we had a one-day free visual workshop, which aimed to work on overview of clinical trials, helping nurses to learn from inception of a clinical trial program to its final stages. So we did this during working with African Nurses and Midwives Network in collaboration with the, in partnership with the Global Health Network and Global Research Nurses, Brenda Wright Clinical Trial Services, and Task Academy in South Africa. We did this by working with the all of these partners to achieve these visual workshops, which aims to also equip nurses in with all the skills they require in clinical trial as a course. As a research nurse, the pandemic has made me to adapt my work, especially in communication, while most of the documentations which were done manually were now done electronically, and we can only have to learn to adapt to the changes there is.
Hello, introducing myself as Joe B.B. George. I'm the Regional Faculty Lead for the Global Research Nurses Network and the Global Health Network. I'm working as a full-time clinical research nurse in a 1,200-bedded tertiary hospital of Northern India. Regional faculties play a crucial role in establishing one-to-one connection between research and researchers. The main aim of regional faculty is to build local research capacity development by setting up skill sharing workshops, organizing local competitions to inculcate research interest among nurses, collaboration between institutes of excellence to explore clinical research, nursing capacity building, and all the above, providing pragmatic solutions for improving evidence-based practice through our online knowledge hub. Till date, we have successfully organized skill sharing workshops in some of the major cities of India, like Mumbai, Gujarat, Bhopal, Delhi, and Hyderabad, covering almost thousands of participants in acquiring knowledge of clinical research nursing through our digitally developed global platform. One of the recent initiatives that is good to report was the essay writing competition that we ran for research nurses and midwives in India. This competition took place before the COVID-19 pandemic. Here, the winners had their essays published, and the winning entry was the role of nurses in improving patient care through clinical research. It was won by Ms. Divya Raghunath. She was a MSc nursing student in Narayana Hrudayalaya College of Nursing, Bangalore. Divya's prize was to attend the Global Summit on Nursing, an experience that she reportedly as highly influential on her and her future career. COVID-19 had profoundly affected our daily lives, but the Global Health Network journey started through its innovative digital platform, enabling accessing and sharing resources. With regard to the future plans of our network, we have decided to organize virtual workshops in some of the nursing colleges of Maharashtra and Chennai. The aim of these activities is to encourage local nursing training institutions to incorporate and enhance the provision of research and skills within their curriculums, increasing the opportunity for professional recognition for nurses working in healthcare. Thank you very much.
The overall aim of the hub is to inspire nurses and midwives to engage in research, to enhance their career, and to bring evidence-led changes to health outcomes within the communities they work in. So please get involved. And how can you do that? You can write a summary or an article to share on the platform to introduce yourself or your team, promote local training opportunities, or design and host a workshop in collaboration with us. We look forward to hearing from you. Thank you.